This episode is brought to you by Gigamon and the 2025 IT News State of Security Report. Stay tuned until the end to hear from Ian Farquhar, the Security Chief Technology Officer at Gigamon, to learn why 97% of CISOs are making compromises on their security strategies, and how deep observability and unified visibility across hybrid environments can help close that gap. Hello and welcome to the IT News Podcast. I'm your host, Eleanor Dickinson. Our guest this fortnight is Noel Toal, the former CIO at DPV Health, a not-for-profit focused on delivering healthcare services across northern Melbourne. During his time at DPV Health, Noel led the organisation's shift from annual penetration testing to a more proactive approach using breach and attack simulation technology. This allowed the team to run bimonthly simulations, helping identify vulnerabilities, strengthen cyber capabilities across multiple attack vectors, and boost the security team's skills and morale. This episode was recorded during the IT News Benchmark Awards in March. Since then, Noel has joined Repurpose It as Chief Technology and Transformation Officer. But for now, let's hear about DPV Health. Why don't we just get started with you sharing what some of your key pillars of your IT strategy and how it affects your approach to architecture, resourcing and investment?
So in fact we're just going through a new ICT strategy at the moment, so we're changing it up a little. The old one was very much infrastructure, systems change, it was a whole lot of foundational pieces to set us up. The new one, which we're going through the process of now, starts to bring in the AI and leveraging more of the data. So we're doing that, but now we're doing more of that and taking the cybersecurity to the next level. And then there's a whole component about thinking about process re-engineering and how we use technology to assist with that. So really drive home the value of the changes, and everyone's layering AI on top, and we're just wanting to take a different approach. I think it really needs to be more embedded in the processes that an organisation does. So we're changing that approach.
Could you just delve into what that looks like from a practical perspective? What kind of change do you need to instigate, and what kind of processes do you need to look at and potentially further develop or even rip out?
You often hear people say, I haven't seen groundbreaking AI yet, and so they're not putting it in. And my argument back is, no, you're the leader, so you're the one who does the groundbreaking, and it's about stitching together different elements of AI in different use cases to create the whole. So I like to say, think of Rome's amazing. You go to Rome, the ancient buildings, and they're all different ages. It's incredible, right? It's more than just one building. AI in a business can be the same thing. A number of small pieces knitted together creates the greater whole. And so don't think about groundbreaking. Think about you put all that together. That's groundbreaking, because then you're really changing the business. And just to dive into it a bit, we're saying let's go re-engineer processes. Like when we created everything we do as a business, some of them were done 10 years ago, 15 years ago, maybe they're 5. The point is they were done before. We've now got the latest Gen AI and other AI coming through so accessible. So would you have built them the same way if you had AI back then? You wouldn't have. We would have done it differently because we would have had AI. So why miss the opportunity to go back and say, now we have got AI, let's start to process map that all out, understand it, map where there's an opportunity with the current tech, apply it, and if the current tech isn't quite there, if the AI isn't at the point where you need it for all of it, at least identify so that when it gets there, you can then plug that in as well. By doing that, you're transforming the whole business and you do it team by team, because every team's got unique needs. And if you do that, then you're really getting the value of AI. You're not just laying it on top and saying, oh, we got some benefit. No, you embed it in the way you work. I think that's the value. But anyway, that's what we're doing. Other people will do it their way too.
You mentioned earlier as well that security is a key pillar for DPV Health. I understand you've made some quite significant milestones in developing and building breach and attack simulation tools. Do you want to delve into that a little bit?
The idea behind this was traditional penetration testing. Depending on your organisation size, many people would do that once a year. You tick the box to say you've done it, and the very next day you could get breached because there's new things that have come out that means you're now vulnerable, but you weren't yesterday when they did the pen test. So what we wanted to do is continually validate throughout the year that what we've got in place works. And so continuous penetration testing through using a breach and attack simulation tool. And we wanted to change it up a bit so that when there's a new attack method comes out, you apply that to these effectively AI-driven pen testing. It works really well and taught us a lot. And the interesting side effect of doing it, instead of sending your people off to learn about the latest attack methods, do courses and things, they actually learn through the tool. Because the tool tries to rip you apart. I say it's ruthless and relentless, and it doesn't care about you. It just wants to find how to get into your network, how to access things that you really don't want it to get near. And so when you look at how it did it, it's all documented. You can see how it did it. And you go, I never realised that was a method to get in. And so then there's a big learning there, and then you take that learning and you go off and you make the change so that couldn't happen again. And so it's direct practical experience with the latest attack methods without you wasting time going off here doing training and then having to go back and then having to look at your own environment. So it's really, I think it's quite powerful. And we can run all sorts of one. You can run black box testing, you can run the grey box testing, you can do targeted testing. You want to test a malware attack, you come up with what you want. You can run all different ones. So we run the main one fortnightly, and then others we probably run another 3 or 4 a month on top of that. So it's really quite powerful.
It's quite a departure from paying one pen tester to come in once a year and doing a big mudsling, and then off he goes. But then you're back to square one.
Yeah, that's right. And the thing is, you run it, you find something, you fix it, you rerun it, it retests it, and you know you've actually fixed it. And sometimes in IT, you'll click the box, it's supposed to have fixed it. Now, how do you know it's really fixed it? And we saw an example of that happen once, where you've done the right thing, you've ticked on the box, but it didn't work properly for some reason. There's a bug, there's an issue there. It goes and rips you apart again, you realise it's not fixed. Even though it looks like it's fixed if you look at the settings, but it wasn't fixed. And the only way you know that is because you've run the tool and it's checked it. It doesn't care about whether the box is ticked, it just cares can it get in via that method, and then you learn and then you change it and you fix it. So yeah, it's quite good. And the scope of a pen test depends on how much money you've got. Have you got one person, the quality of that one person doing the testing. I'm sure that the pen testers don't want to hear me say that, but there is quite a variability in the quality of the one-on-one manual pen test. I think there's great value in it if you've got someone good, but for us, no, this continually running breach and attack simulations you can't beat it. And it's a game. You gamify it because you get a score, you're trying not to get beaten by this thing, and so your team are motivated to beat it, and it really uplifts your quality completely in cybersecurity.
And it gives you a real transparency into what is going on within your network and within your systems. How does that affect your resourcing and your security team resourcing? Do you find now your teams are doing a lot more patching? Does it still allow for that long-term cybersecurity planning?
One of the great learnings from it was patching. We're always doing a lot of patching. And some of the other tools will identify vulnerabilities and they would say this one's critical because if that one gets compromised by that, it's going to be critical. But what we learnt in looking at the attack path that the tool follows is sometimes the critical might be 5 levels down. So it's critical, but they've got to get through 5 other levels to get there. And sometimes it might be a low priority one that gets them the initial foothold, and then they leverage that and they keep moving down till they get to the critical. So that now redirects us on what we need to go and patch, what we need to fix in a more focused way, and try never to get to the critical. Obviously we want to fix them, and we do, but if we stop them up here, they won't get the critical. And we know if they get a foothold, they might find some other way too. Cutting off those, it's given the team a lot of direction on how they should approach it. So while it does generate work, it's more focused work. And so that's taken away this mad rush to get all of the highs and criticals done, with a much more focus on which is the one that's going to hurt us, and that's the one that's going to hurt us earliest. Fix it so they don't get any further down to the other one, and then you fix the other ones. It's really a different way of thinking about it by having a greater understanding of what they've done to you. You get much more documentation around it and explanation than you do from a traditional pen test. They just tell you what they found, and that's serious and whatever, but it's not really telling you, yeah, but how did they get to that one? How do they get to that particular? It's really good.
Can you tell me what some of the AI use cases you're either exploring or developing currently, and how will they align to the business outcomes for DPV Health?
Yeah, so healthcare's got its own particular use cases, and we've started to use it, and we've also started to pilot it, given we'd already built the nice base. The obvious one everyone goes to is AI scribing, so in the consult room, that it's actually recording what happens in the consult so that the doctor, the clinician, can be focused on their patient, because traditionally they were sitting over here doing typing, and sometimes with their back to the client. But this way they just focus on the client, record the whole conversation. It, at the end of that, goes and generates what would be good notes, in theory, for that consult. The GP or the clinician then reviews the notes, says, "Oh, I've missed something, add that in, that was incorrect, change it." They get the final decision, are those notes accurate? Once they've done the edits, they click the button, and then it goes straight into the medical record. And so that is creating a more engaging experience for the client. But also, if you look at the notes it takes, they're very extensive. So you could argue, and depending on the individual clinician, you could argue it sets a consistent standard of clinical note-taking through using a tool like that. But we've done other things. We've used it extensively in development. So we've developed a CRM that's specific for healthcare, and we're using that to drive some process change and improvements and better client engagement. And so to develop that with a small team, we've used AI for testing, AI for development. It's really sped that whole process up. We use AI for sentiment analysis on the cloud-based contact center for both internal and external, to make sure are our team happy, because are the client happy in that conversation, and then working out where we need to improve. Is it more training for the call taker? Is it that the call was directed to the wrong person and they didn't know how to handle it? Have we got a client that's been abusive, and we can pick those up, because zero tolerance on that sort of thing. So there's multiple ways even that a sentiment analysis comes into play. So working with lots of those kind of elements, and then the whole Microsoft Copilot suite, we're playing with all of that, and that's very useful in lots of ways, particularly with changing legislation and that sort of thing. You can get it to do the analysis of your policies, the new legislation, is there a match, is there a gap. You wouldn't rely on it completely, but it gives you a really good starting point to go have a look at what you need to change. So we're just doing it in multiple different ways. I think the more clinical use, that will come later, because I think we need a lot more assurance that it's not going to make a mistake. So we're waiting for that to develop. We're waiting for the guidance on that from the government to change, etc., and then that'll come more into play for us. But I saw a wonderful example which we quite like. It might have been Liverpool Hospital, have what they called a cardiology canon. So they've created a data set of information about cardiology from all around the world, from all the societies researched for 45 years, and now a clinician can go in, type in the query based on a client, and it will go and access all of that information that's clinically sound, because it's a specific set for that use, and then give them the information they need. Now I think that's a good way forward, potentially in some specific use cases, so you could uplift the knowledge of any clinician with this vetted, legitimate medical information, research, etc.
In healthcare, you really have the potential for incredible life-changing developments with technology. But I suppose there is always that you have to have the right governance and the right guardrails in place, because one thing goes wrong and the implications can be catastrophic.
It can be quite catastrophic, yeah. So I think it's always going to be augmenting, not replacing, I would think. I don't know that we'll have quite the confidence to replace a human in that loop, but it could certainly uplift a human's ability. There's quite a lot to deal with. I heard Dr. Fiona Wood when she was presenting on it, and she's the burn specialist, Australian of the Year, and she said, I want to get rid of that cognitive burden so I can focus on what's important when I'm in a consult, when I'm in an operating theatre. And I thought that's really where it adds the value, to take some of that load off and allow the clinician to do what they do best and focus on the client, focus on the issue. So I think great potential with the AI, but yeah, we're very risk averse in healthcare.
Understandably so.
Yeah.
What's next for you then in the context of IT and cybersecurity? What's next on the pipeline for DPV Health?
We're really thinking about the old, you've got all the audits and everything, and we're ticking the boxes, but we're saying there's got to be more value than just ticking a box, right? We're trying to get to the crux of where the weaknesses are, and we know that people are a weakness. In anywhere where we involve humans, we're always going to make mistakes. And so we're saying, how do we improve it so that we can pick up those mistakes? How do we get better at realising that we've made the mistake? Because we tend to do the API and they've got everything working and they forget about it, they walk away and they leave it, it's all supposed to be good, and then someone gets in. And we don't want that, so that doesn't necessarily get picked up with a tick box on an audit. It requires a bit more of a detailed look. We're just working through how's the best way to do that. I've been talking to someone very clever about this sort of thing, and his whole thinking is that really at the end of the day you've got an inkling in your mind that something's not quite right, but you tend not to go and have a look at it because you've got a million other things. And his view is that's exactly the thing you've got to go have a look at. If there's any doubt, you need to go back and recheck, have another look, etc. We're trying to free up time and capacity so we can go and do that follow-up. And so some of this tooling is helping us. We're getting really good results on the BAS runs we're doing now, the pen tests. And so as that quality gets better, it's actually freeing up more time to go and do this other kind of work. So we're doing more of that. And obviously the threat hunting, I think, is something we could do more of. We do it, but we could do more of it, and we'd like to do more of it. It's time intensive, but a great way to find your weaknesses and work out if, you've got something there that could be, or has already been, heaven forbid, already been utilised in a bad way. So I think that's an exciting way to go.
I think that's a great note to end on. Thank you so much for joining us today, Noel.
Thanks for having me. Really enjoyed it.
Every CISO and security leader is aware that the threat landscape is constantly changing, but that change is happening in parallel with significant changes in the way organisations procure, deploy and manage infrastructure. The world has gone hybrid, budgets are being crunched, and evolving technologies like AI are transforming the way people do work. Ian Farquhar, the Security Chief Technology Officer at Gigamon, says that environment presents new challenges that demand new ways of thinking about how to best secure our critical systems and data.
Cloud was meant to actually simplify everything. That was one of the original pitches for it. But the reality is, and for very, very good business reasons, we have landed on this hybrid model where we have massively increased complexity. At the same time, we haven't really increased budgets and staffing remains an issue. In fact, in our Gigamon's 2025 Hybrid Cloud Security Survey, 97% of CISOs admit to actually making compromises to secure their infrastructure. So has security adapted to that new world? Kind of hard to make that case.
With CISOs under pressure to adapt to this rapidly evolving world, they're facing major challenges, as Ian explains.
You've got so many environments to secure, and, again, finding resources to secure it is something that every CISO talks about. But then we've added AI to the mix. Now, business leaders see huge value in AI, and that's absolutely unquestionable. But AI is one of those double-edged sword things in that our attackers are also using AI. So we have 58% of organizations reporting AI-driven attacks. Gigamon itself has the same thing. We see AI used in a lot of attacks on us. 47% of orgs report attacks on actual LLMs in themselves. So it's really been an issue, and the problems are manifold.
Historically, a significant part of security investment has been focused on the endpoint and on firewalls, the so-called doors and moats. But Ian says that needs to evolve.
Endpoint agents and firewalls are going to be around forever. They're an important part of our control set, but we need more modern approaches. They haven't been fit for purpose by themselves for many, many years. Organizations have to get away from this idea that system logging is the be-all and end-all and that agents are the greatest thing. System logging is great, but it's not enough. We need to develop better approaches and we need to apply them across our complex infrastructure.
Ian says a key to being prepared for this new operational and threat environment is visibility.
And I'm not a big fan of military analogies for InfoSec, but there's one I actually really like, and that is to say What army in the world would send their soldiers into battle wearing blindfolds? We are in a cyber conflict. We are facing adversaries. We don't even know who they are. It's a little bit of a cognitive difference that people don't prioritize visibility. And even organizations like the US government CISA have noted that organizations routinely overstate their visibility. Now, here's a positive trend. 64% of organizations say that improving the visibility of threats for threat monitoring, for risk identification, is a focus. The network is your best source of real-time threat intelligence. And the ability to see attackers in your environment and be able to expel them before they do damage. That's what organizations need to do. Stop ignoring the network.
Ian's advice is straightforward. We must start by rigorously assessing the visibility of what is happening on the network.
You need to start looking at what attacks do I expect and do I have the visibility to see them? You need to have the same visibility in all environments, or as close to it as you can get. It's not good enough to say, I'm going to ignore the cloud environment because visibility is too hard. Actually, it's not. You can gain visibility into all of these environments. And the second thing I'd say is you need to have multiple types of visibility. I've said logs are not enough. I'd still do them, but I'd add deep observability, the ability to see network transactions and understand them, real-time network intelligence to supplement them. Defense in depth, we've been doing it for 30 years. We just sometimes forget about it, but we need to return to it.
Defense in depth remains our best tool for countering cyber threats. Monitoring the network so we have visibility of every transaction and all data movement is critical for detecting and blocking attacks. Gigamon and Ian's advice is simple. Ensure you know what is happening on your network, because unless you do, you're entering the cyber battle blindfolded.
That's the episode for this fortnight. Stay tuned for the next episode. And for all the latest headlines and happenings in Australian technology news, head over to itnews.com.au.